My name is Sarah Miles, and I am presenting on chest pain in women for the Nursing 390 class, directed by Professor Farnham. My presentation will be on chest pain in women, and I would first like to start off with the introduction. The teaching session will address the importance of heart disease and chest pain in women. The focus of this teaching session is to inform and educate the female population about the risk factors associated with heart disease, the signs and symptoms of chest pain, and the signs and symptoms of chest pain that differ from male chest pain. The goal is that by the end of the presentation, the patient will recognize the significant role of the cardiovascular disease plays in women and the female indicators of heart attack. The objectives are, by the end of this presentation, the patient will be able to define the risk factors associated with heart disease, recognize the signs and symptoms of chest pain in women, and to differentiate between chest pain in women and men. Before we begin, I would like to also start with this little excerpt from my original teaching plan. While watching a television show, the main character suddenly stops talking and touches his hand on the left side of their chest. What is the first thought that comes to your mind? What do you think the character is experiencing? When you picture the main character, is it a male or a female? Many times, without even thinking about it, the character is almost always a male. Analogies and videos similar to this introduction are being used by American Heart Association to present, educate, and inform Americans of the importance of recognizing chest pain in women. The focus of this teaching session is to inform and educate the female patient about the risk factors associated with heart disease, the signs and symptoms of chest pain, and the different presentations of chest pain in men versus women. By presenting the importance of prevention and recognition of heart disease, many cardiac-related deaths can be prevented. Okay. The need for chest pain education was first discovered or first addressed by the American Heart Association when they realized that women were more likely than men to underreport a heart attack or the signs and symptoms of a heart attack. Through a lot of scientific studies and research, they have discovered that 1 in 3 women are associated with heart disease, more so than the male population. Again, the statistics. Many commercial videos and brochures have been produced to educate the American population about the importance of early detection of a myocardial infarction or a heart attack. Through these advertisements, it is constantly stressed that time saves tissue. However, according to the American Heart Association, little research and education has been done to teach the American population the signs and symptoms that are common in a female experiencing a heart attack. The first statistical fact is that heart disease is the #1 killer that leads to 1 in 3 deaths in women. Heart disease encompasses a broad range of heart problems such as congestive heart failure, heart attack, coronary artery disease, hypertension, high cholesterol, etc. Even though heart disease is the #1 killer in women, women are rarely portrayed as experiencing or showing signs and symptoms of a heart attack. It is estimated that over 43 million in the U.S. are affected by heart disease, and over 90% of women have 1 or more risk factors for heart disease. Again, these are listing all the statistics that I just read to you. As research continues, the AHA discovered that the general population can describe the signs and symptoms of a heart attack in a male, but very few major symptoms of a heart attack in a woman. Although men and women can experience chest pressure that feels like an elephant sitting across the chest, women can experience a heart attack without chest pain or chest pressure. With the research continuing to point to decreasing knowledge of heart attacks in women, the American Heart Association decided to initiate the Go Red campaign. The Go Red campaign has begun to educate general female population about the signs and symptoms of heart attacks in women. Next. slide that we're going to go over is the risk factors associated with heart disease. The first is cardiovascular disease, which is another way of saying heart disease. Again, that can encompass congestive heart failure, heart attacks, history of heart problems. The second is the high cholesterol. The third being high blood pressure. Fourth risk factor is smoking. Fifth is lifestyle, and the sixth is family history. Women that often have a family history of their mother or their grandmother having a heart attack will often be in line as well as have risk factors have heart attacks in the future. Now, the signs and symptoms of a heart attack. Women commonly have same symptoms of a heart attack as men, but there are some instances where the woman's her heart attack symptoms will vary from the male. First, these are the basic signs of a heart attack. The uncomfortable pressure, squeezing, fullness or pain in the center of your chest. It lasts more than a few minutes or goes away and comes back. Pain or discomfort in one or both arms, the back, neck, and jaw, or the stomach. Shortness of breath with or without chest discomfort. And the other signs include breaking out in a cold sweat, nausea, vomiting, and lightheadedness. The different presentation between in women or heart attack in women rather than men is that, as with men, women's most common heart attack symptoms is chest pain or discomfort, but women are somewhat more likely than men to experience some of the other common symptoms, particularly shortness of breath, nausea, vomiting, back or jaw pain. In summary, so heart disease and heart-associated complications are one of the leading killers of women. Cardiovascular disease, high cholesterol, high blood pressure, smoking, lifestyle, and family history are all risk factors associated with heart disease. Signs and symptoms of a heart attack: and arterial disease, uncomfortable pressure, pain, fullness or squeezing in the chest, pain in one or both arms, the back, neck, the jaw or stomach, shortness of breath, nausea, vomiting, or lightheadedness. And the thing that will separate women and men: chest pain in women can present with the same symptoms as a heart attack, but women are more likely to present with shortness of breath, nausea, vomiting, back pain, or stomach pain. Women are 1 out of 5 times more likely to feel like they have an upset stomach or stomach pain with a heart attack than the male is. The conclusion of this teaching session is that by refocusing and redeveloping the common misconceptions of chest pain in women, the general female population will be able to take a step forward to learn the risk factors, implement the change, and prevent heart disease. Using these steps will help women to reduce heart attacks, avoid heart disease, and save lives. To conclude my teaching session, I would first like to list off my resources. And this is also a video from the AHA website that they put out with the Go Red for women. It is a short video about a woman experiencing a heart attack. It's very educational. It's only 3 to 5 minutes. It's very short. I've provided the link in my PowerPoint, and I'm also going to show it to my audience as well. Additional resources, again, I have my handouts listed on here. This is also what is a heart attack, the warning signs, the risk factors. There's also an online quiz that you can take on the AHA website that lists if you can recognize the signs of a heart attack. There are also additional tools on the AHA website, such as lifestyle planning, dietary needs, exercise, lifestyle changes that you can implement to help reduce your risk factor for having a heart attack. These are all of my references. And to end, that is the end of this teaching session. I would like the viewers to watch this short video about heart attacks in women. This is also put on by the AHA. There are also additional resources. And I would also like to hand out my evaluation. I will also post a link to our forum session so you can see me on how well I did on this presentation. And that concludes my chest pain and women presentation. If you have any comments, please be truthful and honest. If you cannot please be inquired, I will upload this link as well to this forum. Thank you.